Number 7, the Honourable Annette King.
My question's to the Minister of Health. What reports has he received in the last month of New Zealanders receiving inadequate health services?
Honourable Tony Ryall.
Mr Speaker, as the member will be well aware, I receive more than 100 ministry reports a month, many of which outline the real progress that the government is making in delivering better health services, but also a few which indicate some health services do need to be improved. One report I have received outlined unacceptable waiting lists, which led to a decision to send 30,000 patients to be culled off the hospital waiting list under the previous government. But now 40,000 more patients a year are getting elective surgery.
Supplementary question, Mr Speaker.
Supplementary question, the Honourable Annette King.
Is he aware in the last month of a report in the Dominion Post headed Flood of Rest Home Complaints, which includes cases of frail older New Zealanders suffering from bullying, surgery delays, malnutrition, poor medication management and bone fractures, with staffing issues being raised as an ongoing problem? If so, how does this satisfy his 2008 expectations, 5 years on, that it's vitally important to maintain public confidence in the standard of care being provided in our rest homes?
Honourable Tony Ryall.
Mr Speaker, the government certainly acts very quickly with any concerns that are expressed about the standard of care of our older people in rest home facilities. What I can advise the Parliament is that we continue to invest very strongly in aged residential care. We're spending more money than ever before, with a particular focus on dementia.
Supplementary question,
Supplementary
Mr.
question, the Honourable Annette King.
Did he read the report in the past month in the Taranaki Daily News headed "New Prescription Fees, a Bitter Pill for Some Patients," in which Taranaki pharmacists have stated that some patients are finding it difficult to pay the increased fee, and it was a struggle for people with multiple scripts, larger families and those on lower incomes? If so, how many of these people were surveyed by the Ministry of Health in a survey which he claimed showed that more people were picking up prescriptions than last year?
Honourable Tony Ryall.
Mr Speaker, a Ministry of Health annual report will be released tomorrow, which actually will debunk the members' attempts to bluster up a problem.
Point of order, Mr Speaker.
Point of order.
Mr Speaker, I asked a question.
The member asked 2 questions.
But that didn't start to address either of them.
No, and I'm waiting to hear the answer to either of the questions asked.
Mr Speaker, the Ministry's survey to be released tomorrow shows that the proportion of people reporting that cost had prevented them collecting a prescription in the last 12 months has declined for adults and children between 2011-12 and 2012-13. Shows, for example, that the number of adults reporting costs related to prescription for not picking it up reduced from 7 to 6 for adults and 7 to 4 for children. The government is investing more in medicines, and in fact the total number of funded prescriptions has continued to increase.
Supplementary question, Mr Speaker.
Supplementary question, the Honourable Annette
Has he seen the report in the Otago Daily Times just 8 days ago, headed "Financial Pressure Blamed," which states the board is under so much financial pressure it's affecting its ability to buy equipment, that they can't replace equipment in the normal timeframes, and replacements can only be made if an item actually breaks? And how will his cost-saving plan, which he has imposed on this board, ensure that patients receive adequate health services?
Honourable Tony Ryall.
Mr Speaker, this government's plan with funding to the Southern DHB sees them last year get an extra $17 million from our government, and their budget is now a record $818 million at the Southern District Health Board, which continues to provide more operations faster than when that member was the failed Minister of Health.
Oh dear, oh dear. Supplementary question.
Supplementary question, the Honourable Annette.
Did he read the report in the Dominion Post in the last month headed low-cost clinics at crisis point as funding dries up? If so, why did he give false hope and false information to such clinics with his announcement that they had received an 85% increase in funding, which he called, quote, our significant increase, when in fact under his 4 budgets they have received a 9% increase in total. And his latest announcement for the 2013-14 year equates to just $5.60 per patient per year for the sickest, poorest patients in New Zealand, and will not make a difference to these clinics.
Honourable Tony Ryall.
Mr Speaker, this government's putting $16 million extra into supporting low-cost practices. But I've also seen a number of reports of headlines that member might be interested in. Surgery delays taking heavy toll. Surgery delay hits cancer clinic. Surgery delay for elderly. Waiting time doubles for heart surgery. Board closed down waiting lists.
Order. Point of order, Grant Robertson.
Almost all of that answer from the Minister was about matters for which he's not responsible, and none of it was answering the question that he was asked.
Order. If members want a concise answer, it's important they ask a concise question. Question number 6, Alfred Naro. Order. The Honourable Clayton Cosgrove will stand, withdraw and apologise for that interjection.
I withdraw and apologise.
Now the member will leave the chamber for the balance of question time. He will leave the chamber. Question number 8, Alfred Naro.
Whakalofori atu ki matolo in support of Niue Language Week, Mr Speaker, to the